In a 6-month double-blind trial published in Hypertension, one of cardiology's most selective journals, half the participants added 30 grams of ground flaxseed to their daily meals. The other half got a placebo powder, identical in taste and texture. After 6 months, the flaxseed group's systolic blood pressure dropped by an average of 10 mm. Most single blood pressure medications produce 5 to 8. A seed outperformed the drugs. Here is what that trial didn't explain, and what this video will. There are 5 seeds with peer-reviewed human research behind them, each targeting a different step in the process that clogs arteries and drives blood pressure up. But there's a catch most health videos skip entirely. After 60, your body has 3 specific physiological changes that quietly block these seeds from working at full strength. By the end of this video, you'll know what those bottlenecks are, how to clear them, and exactly how to combine all 5 seeds into one daily routine your arteries will register within weeks. Before we get into the seeds, quick mental check. Do you know which part of the artery clogging process your current medication doesn't touch? Most people on blood pressure or cholesterol medication have never been told the answer. Keep that question in mind. You'll have it answered before the halfway point. Most people picture arterial plaque the way they picture rust in a pipe, a hard, inert deposit that accumulates in one direction until something breaks. That picture is wrong, and the correction changes everything about how you should think about food and your heart. Plaque is biologically active. It grows, it shrinks, it stabilizes, and it destabilizes, sometimes within the same week, depending on the chemical environment your bloodstream creates around it. The artery wall itself is not passive architecture. It is a living organ lined by a single cell-thick layer called the endothelium, which produces hormones, regulates immune signals, controls how much your vessel can widen or narrow, and decides whether the tissue beneath it stays calm or begins to inflame. The process that builds dangerous plaque has 5 steps. The endothelium gets damaged by oxidized fats, blood sugar spikes, chronic inflammation, or sustained high pressure. LDL cholesterol particles slip through the damaged lining into the artery wall. Free radicals oxidize that trapped LDL, turning it into a molecule the immune system reads as a threat. Immune cells rush in, swallow the oxidized LDL without limit, and bloat into what researchers call foam cells. Those foam cells accumulate, die, and form the soft, fatty core of a plaque, which the body caps with a fibrous lid. A thick, stable cap means the plaque sits quietly. A thin, inflamed cap can rupture, spilling its contents into the bloodstream and triggering the clot that causes a heart attack or stroke. The cap's thickness is something you influence every single day. The 5 seeds ahead each intervene at a different point in that 5-step sequence. Some protect the endothelium before damage starts. Some stop LDL oxidation at the source. Some suppress the inflammation that thins the fibrous cap. Understanding which seed does which, and why your aging biology is quietly undermining all of them, is the difference between adding seeds to your diet and actually moving your numbers. One actionable step this week: write down the 5 stages: endothelial damage, LDL infiltration, oxidation, foam cell formation, cap stability, and as each seed comes up, mark which stage it targets. By the end, you'll have a map no cardiologist visit has probably ever given you. Picture 2 people eating identical seed protocols. Same jar, same 4 tablespoons every morning, same consistency for 3 months. One moves their triglycerides, softens their arterial stiffness, and watches their systolic pressure drop 8 points. The other sees almost nothing change. Same seeds, different results. The difference isn't willpower or consistency. It's 3 specific physiological shifts that happen inside almost every body after 60, and that most nutrition content never accounts for. The first is enzyme decline. Your body converts certain fatty acids into their active cardiovascular forms using enzymes, particularly delta-6 desaturase, which processes omega-6 fats into the anti-inflammatory compounds your arteries need. Research published in Prostaglandins, leukotrienes, and essential fatty acids has documented that delta-6 desaturase activity declines measurably with age, reducing conversion efficiency by a meaningful margin in many adults over 60. When that enzyme is sluggish, seeds rich in precursor fatty acids deliver less of the active compound than the label implies. The second is gut microbiome thinning. Flaxseed's most powerful cardiovascular compounds, its lignans, are not active in the form you swallow them. Your gut bacteria convert them into enterolactone and enterodiol, the metabolites that suppress vasoconstriction and protect LDL. A less diverse microbiome, common after 60 due to reduced dietary fiber variety and frequent antibiotic exposure, produces fewer of these metabolites from the same lignin dose. Less microbial diversity means less lignin conversion, means less arterial protection. The third is reduced bile acid recycling efficiency, which directly limits how well the soluble fiber in chia and flaxseed can pull LDL cholesterol out of circulation. The fix for all three is not complicated. Pre-fermented foods daily, plain yogurt, kefir, or kimchi, to support microbiome conversion. The seed protocol taken with a vitamin C source to recycle antioxidants. And consistent timing, same meal, every day, to keep enzyme pathways primed. These are not optional upgrades. They are the prerequisites that determine whether the seeds work or simply pass through. This week's action: add 1 tablespoon of plain live culture yogurt to the meal where you'll take your seeds. That single step begins rebuilding the microbial capacity your lignans depend on. The most consequential step in the entire plaque-forming sequence is not the one that gets the most attention. It is not high LDL. It is not high blood pressure. It is the moment when LDL cholesterol, harmless while circulating freely, gets oxidized inside the artery wall and transforms into the trigger for everything that follows. Sunflower seeds are the most accessible dietary source of the compound that stops that transformation at its source. 1 ounce of raw sunflower seeds provides approximately 7.4 milligalars of alpha-tocopherol, the form of vitamin E that travels inside LDL particles as a built-in antioxidant bodyguard. This is not vitamin E circulating separately in the blood. It is vitamin E embedded within the LDL particle itself, positioned to intercept free radicals before they can oxidize the lipid cargo. When your dietary alpha-tocopherol intake is adequate, each LDL particle carries a full complement of that protection. The free radicals that encounter it are neutralized. The LDL passes through the bloodstream in its native form, invisible to the immune system, harmless to the artery wall. Here is what most people have never been told. Having high LDL is not, by itself, what causes plaque. Some people with elevated LDL never develop significant atherosclerosis. Some people with normal LDL develop severe disease. The variable that separates them is oxidation rate. How much of their LDL is getting chemically altered before the immune system sees it? It is not how much LDL you have, it is how much gets oxidized. Sunflower seeds also supply selenium, a cofactor for glutathione peroxidase, the enzyme that neutralizes hydrogen peroxide in endothelial cells before it can crack the arterial lining that lets LDL in. And they provide phytosterols, particularly beta-cytosterol, which compete with dietary cholesterol for intestinal absorption sites, modestly reducing how much LDL enters circulation in the first place. A meta-analysis in the American Journal of Clinical Nutrition found that 2 grams of daily phytosterols reduced LDL by approximately 10%. This week's action: swap any salted roasted sunflower seeds in your pantry for raw, unsalted. Roasting degrades alpha-tocopherol. 1 ounce daily on salads, oatmeal, or yogurt, raw, is the target. What if the reason your omega-6 intake isn't reducing inflammation, isn't the amount you're eating? but a single enzyme that's been quietly slowing down for the past decade. After 60, delta-6 desaturase becomes the central problem in omega-6 metabolism. Most omega-6 fats in the diet require this enzyme to convert them into gamma-linolenic acid, the anti-inflammatory compound your arterial wall actually uses. When the enzyme is sluggish, the conversion stalls. You are eating the precursor, but producing very little of the active molecule. The inflammatory side of your prostaglandin balance keeps winning, not because you aren't trying, but because the conversion pathway is bottlenecked. Hemp seeds bypass the bottleneck entirely. They are one of the few food sources that provide gamma-linolenic acid in preformed, ready-to-use state. No enzymatic conversion required. A 2016 review in the European Journal of Nutrition confirmed that preformed GLA from food sources produces measurably greater shifts in prostaglandin balance than equivalent doses of linoleic acid requiring conversion, particularly in older adults. Your arterial wall is in a constant tug-of-war between two chemical teams. One team, led by prostaglandin E2 and thromboxane A2, constricts vessels, promotes platelet clumping, and accelerates inflammation. The other, led by prostaglandin E1, dilates vessels, keeps blood flowing freely, and calms the inflammatory signaling that thins the fibrous cap over existing plaque. After 60, the constriction team is winning on most days. Hemp seeds send reinforcements to the side that is losing. 3 tablespoons of hulled hemp seeds also deliver approximately 9–10 grams of protein rich in arginine, the amino acid your endothelial cells convert to nitric oxide. Nitric oxide relaxes smooth muscle in the artery wall, prevents platelets from aggregating, and suppresses the adhesion molecules that allow immune cells to grab onto the endothelial surface and begin the foam cell process. Research published in Arteriosclerosis, Thrombosis, and Vascular Biology found that nitric oxide suppressed vascular cell adhesion molecule expression, reducing monocyte adhesion by over 50% in endothelial cell models. This week's action: add 3 tablespoons of hulled hemp seeds to a smoothie or stir into morning oatmeal. Their mild, creamy flavor disappears into almost anything. Your doctor measures your blood pressure in seconds. What that reading cannot tell you is which of several completely different biological processes is driving the number up. 2 of the most common culprits in adults over 60, blood viscosity and arterial glycation, are almost never discussed in the same conversation, despite the fact that they feed each other and that one seed addresses both simultaneously. Blood viscosity is the thickness of your blood as a fluid. Most people think of blood pressure as a plumbing problem, pipes too narrow. But pressure is equally a fluid problem. Thicker blood requires more force from the heart to move through the same vessel. After 60, fibrinogen levels rise, red blood cells become stiffer, and platelet reactivity increases, all of which thicken the blood and raise the pressure your heart must generate with every beat. A study published in the European Journal of Clinical Nutrition found that chia seed consumption significantly reduced triglyceride levels, inflammatory markers, and blood fluidity measurements in adults with cardiovascular risk factors. The mechanism is chia's approximately 5 grams of alpha-linolenic acid per ounce, an omega-3 that reduces fibrinogen, increases red blood cell membrane flexibility, and shifts thromboxane balance toward the anti-aggregatory side. Every time blood sugar rises after a meal, glucose molecules react non-enzymatically with proteins in the artery wall, forming advanced glycation end products. These cross-link collagen and elastin fibers, making the vessel wall progressively rigid. Stiff arteries cannot expand to absorb the pressure wave from each heartbeat. The full force registers in your systolic reading. This is the primary reason systolic pressure rises so sharply after 60, while diastolic often stays relatively stable. You can stop new glycation from forming today. Chia seeds form a thick soluble gel in the stomach and small intestine that slows glucose absorption from whatever meal surrounds them. A study in diabetes care found that a gel-forming fiber with comparable viscosity to Chia mucilage reduced postprandial glucose spikes by approximately 30%. Across hundreds of meals per year, that reduction means dramatically less glycation accumulating in the arterial wall, less cross-linking, more elasticity, lower systolic pressure over time. This week's action: soak 2 tablespoons of chia seeds in half a cup of water for 10 minutes before your largest carbohydrate meal of the day. The gel that forms is the active mechanism. Let it develop before you eat. You now have 3 of the 5 seeds, and the biological logic connecting all of them. Sunflower seeds guarding LDL before it oxidizes. Hemp seeds rebalancing the prostaglandin tug-of-war your aging enzyme can no longer manage alone. Chia seeds slowing the glycation that stiffens your arteries meal by meal. The 2 seeds still ahead are where the clinical evidence gets genuinely surprising, particularly the one in the number 1 position, where a single trial produced blood pressure reductions that made cardiologists look twice at the data. If this level of specificity is useful to you, subscribe and hit the bell. The next video in this series covers the 3 blood markers that will show you whether this protocol is working, often before your doctor notices the change. Now, seeds 4 and 5. In the early 1980s, when pharmaceutical researchers were developing the first calcium channel blockers, amlodipine, nifedipine, diltiazem, they were solving a specific problem: calcium ions entering smooth muscle cells in artery walls, triggering contraction, narrowing the vessel, raising pressure. The drugs worked by blocking the channel. What those researchers did not publish in their press releases was that magnesium had been doing the same thing in human physiology for millions of years, through the identical mechanism. 1 ounce of raw pumpkin seeds provides approximately 150 milligauss of magnesium, roughly 37% of the daily recommended intake. Magnesium sits at the calcium channel and competes for entry. When magnesium levels are adequate, calcium entry is moderated, smooth muscle stays relaxed, and vessels remain wide. A meta-analysis in hypertension, reviewing 34 randomized controlled trials, found that magnesium supplementation produced significant reductions in both systolic and diastolic blood pressure, with the strongest effects in people who were deficient at baseline, which studies estimate is up to 68% of adults over 60. Pumpkin seeds also deliver zinc, a cofactor for superoxide dismutase, the enzyme that neutralizes the free radicals destroying nitric oxide in the endothelial wall. Research in the American Journal of Clinical Nutrition found zinc status was inversely associated with cardiovascular event risk even after adjusting for other factors. Magnesium additionally suppresses arterial calcification, the process that hardens plaque and creates structural weak points where rupture begins. Research in the Journal of the American Heart Association found higher magnesium intake was associated with significantly less coronary artery calcification on CT scanning, dose-dependently. Most people over 60 are running chronically short on both minerals simultaneously. This week's action: 1 ounce of raw pumpkin seeds daily. Combine with your sunflower seeds into a single snack to cover both mineral and antioxidant bases simultaneously. Imagine 2 faucets controlling arterial constriction. Your blood pressure medication, if you take an ACE inhibitor, turns down faucet 1, angiotensin 2. Most cardiologists never mention faucet 2. Endothelin 1, a vasoconstrictor research has shown is more potent and longer lasting than angiotensin 2. Flaxseed's lignans turn down faucet 2. Your gut bacteria convert flaxseed's primary lignan, secoisolaris-iresinol diglucoside, into enterolactone, which directly inhibits endothelin 1 production in damaged endothelial cells. Less endothelin 1 means less prolonged arterial constriction, less smooth muscle proliferation inside the vessel wall, and meaningfully lower resting blood pressure through a pathway your prescription likely leaves completely untouched. The clinical evidence behind flaxseed is the strongest in this entire protocol. A double-blind, randomized controlled trial published in Hypertension gave participants 30 grams of ground flaxseed daily for 6 months. Systolic pressure dropped an average of 10 mm/h. Diastolic dropped 7. The researchers described it as among the most potent antihypertensive effects ever recorded from a dietary intervention. That lignin conversion depends heavily on the gut microbiome diversity discussed earlier, which is precisely why the yogurt step is a prerequisite, not optional. Flaxseed also contains up to 800 times more lignins than any other commonly consumed food, and its soluble fiber binds bile acids in the intestine, forcing the liver to pull LDL from circulation to manufacture replacements. Flaxseed targets the constriction pathway your medication probably skipped. This week's action: 2 tablespoons of freshly ground flaxseed daily, grind in a coffee grinder, store in the freezer, and add cold to food after cooking to protect the omega-3 fats from heat oxidation. The seeds only work as well as the biology receiving them. 3 steps maximize absorption before the first spoonful. Take the seed mix with a vitamin C source, a kiwi, strawberries, or a squeeze of lemon. Vitamin C chemically regenerates alpha-tocopherol after it neutralizes a free radical, recycling it back to active form. Never heat the mix. Alpha-linolenic acid in flaxseed and chia oxidizes rapidly above moderate temperatures, converting a cardiovascular asset into a pro-oxidant liability. Add seeds to food after cooking, never during, and keep timing consistent. The enzyme pathways that process these fatty acids are primed by regular substrate arrival. Same meal every day keeps the pathway running at its limited but trainable capacity. Inconsistent dosing gives inconsistent enzymes nothing to work with. This week's action: set 1 mealtime as your permanent seed window. Breakfast is ideal, and pair it with any vitamin C containing food already in your routine. Which part of the artery clogging process does your current medication leave completely unaddressed? Here is the honest comparison. Statins reduce LDL quantity. The seed protocol reduces LDL through 3 mechanisms: phytosterol competition, bile acid binding, omega-3 lipid metabolism, and additionally prevents LDL oxidation, which statins do not touch. Calcium channel blockers block calcium entry into smooth muscle. Pumpkin seed magnesium does the same thing through the identical mechanism, without the ankle swelling or constipation. ACE inhibitors suppress angiotensin II. Flaxseed lignans suppress endothelin 1, the more potent constrictor ACE inhibitors leave running. Aspirin reduces platelet aggregation. Chia and hemp omega-3s reduce platelet aggregation through prostacycline rebalancing, and additionally reduce blood viscosity through fibrinogen reduction, an effect aspirin does not provide. The seeds do not replace your medication. They cover what your medication cannot reach. This is not a competition between food and pharmacology. It is a recognition that cardiovascular disease operates across more mechanisms than any single drug, or combination of drugs, was designed to address simultaneously. This week's action: bring this mechanism comparison to your next cardiology appointment and ask specifically which pathways your current prescriptions leave unaddressed. A monthly statin prescription costs $15 to $50. A calcium channel blocker, $20 to $60. A cardiac catheterization, upward of $30,000. The daily cost of this entire 5-seed protocol is approximately $1 to $2. In a large jar, combine 2 cups each of ground flaxseed, chia seeds, whole hemp seeds, raw sunflower seeds, and raw pumpkin seeds. Mix thoroughly. Store in the refrigerator or freezer. Every morning, scoop 4 tablespoons into breakfast, oatmeal, yogurt, a smoothie, or a glass of water. That 4-tablespoon serving delivers the complete spectrum: omega-3 fatty acids, preformed GLA, lignans, alpha-tocopherol, phytosterols, magnesium, zinc, arginine, and soluble fiber. Approximately 200-250 calories, 8 to 10 grams of complete protein. The aging bottleneck is managed by the yogurt pairing. The vitamin C recycling is handled by whatever fruit is already in your breakfast. The enzyme priming happens automatically when the timing stays consistent. 1 jar, 4 tablespoons. Every mechanism in this video covered daily. This week's action: build the jar this weekend. The total ingredient cost at most grocery stores is under $14. 5 seeds, 10 mechanisms, 1 aging bottleneck that quietly blocks all of them, and 3 simple steps that clear it. Plaque is not cement. The cap over existing plaque is something you influence at every meal. The enzymatic conversion your body needs, the microbial diversity your lignins depend on, the glycation accumulating with every blood sugar spike, all of it responds to 4 tablespoons in a jar. Not professional advice. Consult a qualified expert as needed.